think you're talking about easing some of the restrictions.
Precisely.
Yes. So I think if you look at the data as of now, I think this is about the best data we have had for the past 2 years. But we've been somehow close to this era before. I mean, whereby we have very, very low figures, and then we have the advent of a variant, and there's a surge. But the only differentiating factor is that now we have vaccines. So prior to this period, we are not having vaccines, so people are not vaccinated. Now, as I speak, I would say that about 25% of Ghanaians are fully vaccinated. So there's a level of protection. So I think it's quite right if we try to do the easing whilst we try to monitor. So we are the best time to do some easing, but we still want to be very cautious.
And I'm glad that you're touching on that last leg of being cautious. The concern out there is also about the figures in our sub-region and neighboring countries as well. Is the Ghana Health Service mindful of these figures, and what lessons are you drawing from neighboring countries and what's happening there as well?
Yes, so if you look at the curves in ECOWAS, we normally have these ECOWAS meetings on every Tuesday. The shape of the curve is the same in all the neighboring countries. So the burden of disease in our neighboring countries is about the same as Ghana. So there's very little about dilution effect if you decide to open the borders. So I think that unlike before, that people were not testing, now we think that the case burdens on both sides of the borders are fine. So I think we can decide to ease. But I think that what we want to look at is how are you going to do the easing? So our main focus is about vaccination, because vaccination gives a level of protection, and that's what we want to focus on. So even if you decide to ease, we should have a borderline of being vaccinated before it goes borders.
I get the points there. Now, how about the protocols at the land borders? It has been one of the challenges for the Ghana Health Service as compared to the airports. It was easy installing safety mechanisms and trying as much as possible to check importation and persons who are coming into the country. But how's that going to be possible at the land borders? You agree it's going to be a very cumbersome exercise, isn't it?
Yes, so what we intend doing, you see, the land borders, we have port health, we have immigration, we have national security, they are all at the borders. So one critical thing we're going to be looking at is the vaccination cards. And then that's going to be the main tool to enable you cross. So those are the things that we're going to be looking at.
Explain that for me briefly. What you're going to have is that persons who need to move through the borders must possess certificates from where exactly?
Yes, what they are saying is that if we are going to be easing, we are not likely to be tested at the borders. What we're looking for, we're going to look for your possession of a vaccination card or vaccination identity. So that is what we're going to be inspecting on the borders.
How about
and that will be done by the immigration and then the port health staff across. So clearly, those are the things that we are considering. So unlike maybe the airport that we tested, we'll be looking at your possession of a vaccination card. But these are early days yet, and that is what we think that will be the game changer if you need to open the borders.
Indeed, and we'll come to some other aspects. Dr. Bekoe, just hold on.